Hi there, and welcome to this presentation on a career in social work. Let's start with what social work is defined as. The International Federation of Social Workers created this definition. Social work is a practice-based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility, and respect for diversities are central to social work. Underpinned by theories of social work, social sciences, humanities, and indigenous knowledges, social work engages people and structures to address life challenges and enhance well-being. In the slides that follow, I will try to explain what social workers do, the common areas of social work in Ireland, what medical social work is, what model is often used, and what a day in the life of a medical social worker looks like. I've explored some traits that might help you decide if social work is for you, how you can become a social worker in Ireland, and finally, some pros and cons on a career in social work. So, what do social workers do? Social workers are trained professionals who collaborate with service users and other professionals to empower people, help them manage challenges, and improve their quality of life. Assessment and problem solving. Assessment is the process of gathering, analyzing, and interpreting information to understand a client's situation holistically. It involves looking at multiple aspects of a person's life. Problem solving is the process social workers use to help clients address challenges and achieve goals. In short, assessment tells you what the situation is, while problem solving determines what to do about it. Empowerment and advocacy. This involves focusing on a person's strengths, helping them to reach their potential, to meet their own needs, and to make decisions for themselves. And when needed, advocating on their behalf to access necessary services and resources, such as housing assistance, home supports, residential care, or legal help. Intervention and support. This involves providing a range of interventions, including individual counseling, family support services, crisis intervention, and group work, to help people cope with a variety of difficulties like mental illness, addiction, disabilities, and/or family conflict. Policy and community work. Social workers engage in policy and community work to tackle social inequalities and promote social justice. They advocate for human rights, influence social policies on issues like housing and health, and collaborate with statutory and voluntary organizations. By combining direct practice with efforts to create systemic change, social workers help build more inclusive and equitable communities. Social work in Ireland covers diverse areas, including child protection, mental health, disability services, older person services, addiction services, criminal justice through the probation service, and medical and health related social work. Children and families. Social work in child protection services in Ireland primarily work in TUSLA. They work to ensure the safety and welfare of children by assessing risks such as neglect, abuse, or family difficulties and putting supports in place to keep children safe. They carry out home visits, develop safety plans with families, coordinate services like parenting supports and mental health interventions, and work closely with schools, Gardaí, and healthcare providers. When necessary, they bring cases to court to seek care orders or other protective measures, while also supporting family reunification where safe. Social workers in mental health services in Ireland, working within the HSE's community mental health teams, inpatient units, and specialist services, support individuals experiencing mental health difficulties through a combination of therapeutic, practical, and advocacy work. They assess a person's social, emotional, and environmental needs, provide counselling, crisis intervention, and recovery focused support, and help individuals and families understand and manage mental health conditions. Disability services. This area involves supporting individuals with both physical and intellectual disabilities as well as their families. Social workers in disability services support children and adults with physical, intellectual, sensory, and developmental disabilities by assessing needs, coordinating individual care plans, help families navigate HSE services such as the Children's Disability Network teams, adult day programs, respite, and personal assistance supports. They provide counseling around diagnosis, transitions, and family stress, ensure to access social welfare entitlements, and promotes rights and inclusions in line with the United Nations Convention on the Rights of Persons with Disabilities. Older person services. Social workers assist older adults by assessing their needs and coordinating supports in areas such as medical social work in the acute setting or in rehabilitation units, primary care teams, multidisciplinary integrated programs for older people, psychiatry of later life teams, and safeguarding vulnerable adult teams. They provide advice and information on how to access entitlements like the state pension, carers allowance, or the Fair Deal nursing home support scheme, while also advocating for their rights within health and social care systems. They also provide counselling and emotional support, assist with advanced care planning, and support family members by providing emotional support, advice and information on helpful services, respite options, and navigating complex HSE processes. Addiction services. This field focuses on supporting individuals and families affected by substance misuse. Social workers in addiction services in Ireland play a vital role in supporting people affected by substance use, for example, drugs, alcohol, gambling, prescription medication, and others, and the families around them. Their work focuses on treatment, harm reduction, rehabilitation, and social support. Criminal justice. Many social workers work in the probation service or other parts of the justice system. In Ireland, social workers in the probation service play a central role in helping people who have offended or are at risk of offending to change their behaviour, reduce reoffending, and improve their social circumstances. Their work combines rehabilitation, risk management, and community safety. Medical and health related social work. Medical and primary care social workers provide support across hospitals and other healthcare settings by helping patients and families navigate illness, treatment, and discharge planning. In hospitals, they assist with crisis intervention, bereavement support, safeguarding concerns, support with family issues, and coordinating community services to ensure safe transitions from the acute setting. Within primary care teams and local health offices, social workers offer early intervention and community based support by assessing social and emotional needs, addressing issues such as isolation, disability, housing, and financial hardship, and connecting individuals with appropriate HSE and voluntary services. Their role bridges medical care and social support, ensuring that people receive holistic, person centered care that addresses both their health and broader life circumstances. So, what is medical social work? Medical social workers assist patients and families by helping to resolve any psychological, social, practical, or emotional difficulties during the patient's hospital stay. The medical social worker often uses the biopsychosocial approach to understanding a person's health. The biopsychosocial model in social work is a holistic framework that understands a person's well-being as the result of the complex interplay between biological, psychological, and social factors. The biological, the body, means physical health or illness. The psychological, the mind, means feelings, thoughts, and mental health. The social, the life situation, means family, friends, money, housing, community, and other issues. Social workers use this model to assess clients comprehensively, recognizing that problems rarely arise from one cause alone. This approach guides interventions that address all relevant areas, coordinating medical treatment, counseling, social supports, and community resources to promote recovery and resilience. A day in the life of a medical social worker is highly varied and often unpredictable. Focus on providing crucial emotional and practical support to patients and their families within a hospital or healthcare setting. Their primary goal is to ensure patients can cope with their illness and facilitate a safe transition back home or to an appropriate care facility. The patient's wishes need to be central to all pieces of work carried out. The day typically begins with administrative tasks, checking emails, reviewing patient notes, and preparing for scheduled appointments or potential crises. Multidisciplinary meetings. Medical social workers often attend multidisciplinary meetings with doctors, nurses, physiotherapists, occupational therapists, and other healthcare professionals to discuss patient progress, concerns, and discharge planning. Initial assessments. Social workers carry out initial psychosocial assessments for new patients, inpatients, or those in the emergency department to understand the social, emotional, environment, and financial factors impacting their health and recovery. Patient and family consultations. Meeting with patients and their families to offer supportive counseling and information regarding diagnoses, treatment plans, and available resources. This can involve highly emotional situations such as a new terminal diagnosis or bereavement support. Advocacy. This involves acting as an advocate for patients to ensure their voices are heard and their rights are respected within the complex healthcare system. Crisis intervention. This involves responding to immediate crises such as domestic violence concerns, child protection issues, homelessness, or sudden change in a patient's condition. Discharge planning. This is a major component of the role is coordinating safe and timely discharge plans. When discharge planning takes place, there can at times be varying views amongst family members or loved ones in relation to what needs to happen for the patient. It's important for the patient to be central to these meetings if they are willing and able. If they are unable to attend or do not wish to, the social worker can advocate on their behalf to ensure their wishes are kept central to any plans being made. Liaison and referrals. Making referrals to a wide range of external statutory and voluntary agencies for ongoing support with issues such as housing, addiction services, financial benefits, or mental health support. And finally, documentation. Maintaining accurate and confidential records and writing comprehensive reports for patient files is essential for continuity of care and legal compliance. So, is social work for you? Many of the skills needed for social work you will learn in your social work training. The following traits may help you in your social work career. Patience. Patience is essential because social change and personal growth often take a significant amount of time. Social workers frequently deal with complex, long-standing issues such as addiction, trauma, or systemic poverty. Patience is required when navigating slow-moving bureaucratic systems, waiting for resources to become available, or dealing with lengthy legal processes. It's also important when building trust. Trust with service users is built over time. A patient approach allows a social worker to establish rapport and ensure the service user feels heard and respected. Managing crises. Maintaining composure and patience during high-stress situations or crises is vital for effective decision-making and de-escalation. Empathy. Empathy is the ability to understand and share the feelings of another. It is arguably the most fundamental trait for a social worker. Understanding perspective. Empathy allows social workers to genuinely comprehend a client's struggles from their point of view, even if that experience is vastly different from their own. Validation. Expressing empathy helps clients feel validated and heard, which is a crucial first step in any therapeutic or supportive relationship. Being non-judgmental. Working without judgment means approaching every individual with an open mind, regardless of their background, choices, or circumstances. It is so important when building rapport. A non-judgmental stance is critical for building trust. Clients must feel safe enough to share sensitive information, past mistakes, or difficult situations without fear of moral criticism. Ethical practice. Social work is guided by a strong ethical code that mandates respect for the inherent dignity and worth of every person, requiring a non-judgmental approach as a core principle. Objective assessment. Suspending judgment allows for a more objective and holistic assessment of a situation, leading to more appropriate and effective interventions. Flexibility. Flexibility is key to managing an unpredictable workload and adapting to crises. Social workers must be ready to drop current tasks to address immediate crises, whether a child protection emergency or a patient needing urgent discharge planning. This is also important when tailoring approaches. Every client is unique. A flexible social worker can adapt their communication style, intervention methods, and support plans to meet the specific changing needs of the individual or family. Working with different systems. This role involves liaising with various systems, all of which have different rules and operating procedures that require adaptability. Cultural competence. Cultural competence involves the awareness of one's own cultural worldview, coupled with an attitude toward cultural differences and knowledge of different cultural practices and worldviews. Respectful practice ensures that services are delivered in a way that respects the client's cultural values, beliefs, language, and tradition. Critical thinking. Critical thinking is the ability to analyze facts, evidence, and observations and arguments to form a sound judgment. This is used daily in complex case management. Case analysis. Social workers must analyze vast amounts of information from various sources to identify core problems and potential solutions. Problem solving is used to evaluate the potential outcomes of different interventions, anticipate risks, and make sound, evidence-based decisions under pressure. Advocacy. Critical thinking is vital for developing sound arguments when advocating for a client's rights or challenging unfair systematic policies. An interest in human rights and social justice. The foundation of social work lies in a commitment to human rights and the pursuit of social justice. This interest provides the moral compass for the profession, driving practitioners to address systemic oppression, inequality, and discrimination. A strong commitment to these principles helps sustain motivation in a demanding field, reminding social workers that their work contributes to a larger societal good. Social workers are often advocates for policy change. A passion for social justice fuels efforts to challenge unfair laws and promote equitable distribution of resources. So, how can you become a social worker in Ireland? The social work qualification pathways are including a Bachelor of Arts in Social Work or Social Studies, any Level 8 degree plus a postgraduate diploma in social work, a Level 8 degree with a Master's in Social Work, Tertiary degree, a Bachelor of Social Work Honours, HSE or TUSLA social work apprenticeship programs. Where you can do a BA or equivalent in social work. First option is Trinity College Dublin. This is a 4-year full-time course. The other option is University College Cork. However, this is for mature students only. So as this presentation is for students from the Leaving Cert who are hoping to enter social work, I won't go into too much detail on this slide. However, feel free to pause the slide and have a look at the different ways to become a social worker once you have completed a Level 8 degree. So here we have one of the newer pathways to becoming a social worker in Ireland, the Bachelor of Social Work Honours in University College Cork, which is a 4-year full-time course. You can see here the requirements to entering the course, leaving cert with 5 subjects, pass grade at ordinary level, or leaving cert with 4 subjects at ordinary level with a distinction in LCVP. You can hold a QQI level 4 with a minimum of grade of distinction, or be mature applicants and in which they look at previous education, your work experience, and demonstration of competence to undertake the program, which would be interview. So again, here is one of the newer pathways into social work in Ireland, the social work apprenticeship. Apprentices are employees of an employer partner, often TUSLA or the HSE. They work on the job for part of the time, acquiring real hands-on social work experience, and spend the rest of the time in college. These programs are CORA approved, which means on successful completion, you're eligible to register as a professional social worker in Ireland. For this course, you do need a level 8 before entering the apprenticeship program. This slide and the following slide provide further information on the eligibility criteria for the apprenticeship program that I mentioned in the previous slide. While studying as an apprentice, you will be working towards achieving either a Master of Social Work or a postgraduate diploma in social work studies. Either of these will allow you to register as a professionally qualified social worker with CORU on completion. The key requirements for these academic routes are a Level 8 degree and a minimum of 3 months relevant work experience in a social work or social work related field. In relation to the apprenticeship program, you may still be eligible under the recognition of prior learning routes. This includes a Level 8 in any discipline, honours degree in any subject, and at least 12 months relevant experience, a Level 7 degree in social science, so an ordinary degree, and at least 3 years relevant experience, and for non-graduates, at least 5 years professional experience in social work or social work related field. So to conclude, I'm going to go through some of the pros and cons of a career in social work. I'm going to start with the cons. Emotionally demanding and stressful. The role can involve seeing significant pain, suffering, and challenging situations daily, which takes a considerable emotional and mental toll. Burnout is a notable risk in the profession. High workload and unpredictable hours. Social workers often face high workloads, busy environments, and unpredictable hours, making work-life balance difficult to maintain, especially in areas such as child protection. This is more manageable in other areas of social work. Navigating bureaucracy and limited resources. Frustration can arise from navigating complex bureaucratic systems, managing large amounts of paperwork, and dealing with limited resources. Safety risks. Depending on the specific role and environment, social workers may encounter aggressive or volatile behavior from clients, which presents physical safety risks at times. Public perception. Many people may not realize just how wide ranging social work is. Often the public associates social work mainly with difficult areas like child protection, but in reality, social workers support individuals and families across many aspects of life, from health and disability to community well-being and mental health. Social workers in child protection often face challenging public perceptions. Because their work involves difficult decisions, such as child safety interventions, they can sometimes be misunderstood or collectively judged, which can make their already demanding role even harder. However, despite these challenges, many social workers in child protection find their career deeply fulfilling. Now let's move on to the pros. Deep job satisfaction. The primary pro is the ability to make a meaningful, positive impact on vulnerable individuals, families, and communities. Witnessing positive change and helping people improve their lives provides deep personal and professional fulfillment. High demand and job security. There is a significant and ongoing demand for qualified social workers across Ireland, leading to really good job security and a wide range of available positions in various sectors. For example, child protection, medical, primary care, mental health, disability services, probation services, and others. Diverse career opportunities. The qualification offers versatility to work in many different settings and specialities, from statutory agencies like TUSLA and the HSE to hospitals, communities, prison systems, and many other areas. Competitive salaries and benefits. While pay varies by experience and specialisation, social workers in Ireland can expect competitive salaries, pension schemes, and opportunities for further education and training. Professional and development. Employers often prioritize training and professional development opportunities and support continuous learning and career advancement. Thank you all so much for listening. I hope you have enjoyed learning more about social work. If you have any questions, feel free to put them into the chat. Thank you.